Hello and welcome to the Reawaken Your Health podcast. I'm very excited to share a new guest today, Dr. Debra Muth, who is a naturopathic physician in Wisconsin. We just recently met, and I am excited to share her background and her unique story with you as we talk about MS, mitochondrial health, chronic diseases, and much more. So thank you for joining us today, Deb. I really appreciate it.
Thank you. I'm happy to be here and happy to have this conversation with you.
This is great. So, can you tell me a little bit about your story? I know you have a chronic condition yourself. Can
Mhm.
you just kind of share how you came across to getting diagnosed and kind of what happened?
Yeah, absolutely. It was 2022, early part of 2022. World was crazy, right? Everything was stressful. And I got sick with COVID, pretty much unremarkable, no issues, no big deal. And about 6 months later, I started noticing some odd symptoms, a lot of neck pain, but I was starting to get this weird tingling feeling. I would get the feeling as though somebody brushed a feather across my face. I would get the same type of feeling across my lower legs. One day it would be one leg, one day it would be another leg. And I'm a huge walker. I love to walk. That's my stress reliever. And all of a sudden, I started noticing I was getting this numbness in my toes. And of course, the first thing I thought of is, gosh, these shoes are feeling pretty tight, or maybe my socks aren't quite right. The first day wasn't a big deal. The next day, it was there again. And I was like, well, this is odd. And the symptoms kind of kept progressing. I've got a lot of degeneration in my neck. I've had a couple of auto accidents and have some degeneration and really thought that this was all neck related. I would sit on the couch, hold my phone, my arms would get numb. So of course it was carpal tunnel or it was my neck being pinched. And so I went and had an MRI done of my neck, and my neck looks terrible on scan. And so I saw my orthopedic doctor, and I'm explaining all these symptoms to him. And he looks at me and he says, "You're a really bright lady. You know this isn't your neck." And I'm looking at him like, "What are you talking about? This is my neck."
Yeah. Mhm.
And nowhere on my radar was a neurological condition. Honestly, it was just never there. And he looked at me and said, "I think you have MS." And I said, "You're crazy. This is not MS. This is my neck." And we joked a little bit. And he said, "Do me a favor, get a brain MRI." And again, we joked a little bit and talked about, you just want to see that I have a brain. And, we made
Yeah.
some typical colleague jokes, right? And I agreed. I went and got the brain scan, and lo and behold, I had white matter disease. And I thought, okay, this is really strange. In my world of naturopathy, white matter disease is infection or toxins until proven otherwise. And so it was the day before Christmas Eve on 2022 when he called me and said, "You have white matter brain disease, Deb. You have MS." And I thanked him nicely and said, "Thank you, but I'm not accepting that diagnosis because this is my world, and my world knows
Yeah.
this can be something other than that." And he encouraged me to see neurology and get on some medication right away because it's early, and all these drugs that'll suppress my immune system will help me. And I declined, and I said, "No, thank you, but thank you. I'm gonna manage this my way a little bit." And so I did just that. I treated a lot of MS patients over my career. So I knew what I was looking for, but I thought, I really need to dig into this and figure out what's going on. And what other things besides the things that I knew could cause MS, like Lyme disease and mold toxicity and heavy metals and chemicals and all of that kind of stuff could be an issue. And so I started really digging back into my history. And this is what I encourage a lot of my clients to do, is dig back into your history and find that timeline. When you had a traumatic brain injury, when you had a car accident, did you get sick really bad? And that triggered some of your symptoms. And so I started making this timeline and going,
Okay.
okay, I had a traumatic brain injury when I was 10. I had another neck injury in whiplash in a car accident when I was 18. And, I had this injury and that injury. And all of a sudden I was like, holy cow, I've had like 6 traumatic brain injuries that I never really looked at in its entirety,
Yeah.
and started going into the research and seeing, what does traumatic brain injury do? What's the connection with MS? And found a huge connection with traumatic brain injury and MS. Um, so started doing some brain repair and some repair on neurology, so to speak, because I never really did a lot of neurology stuff in my practice. Reached out to a few of my colleagues and started learning from them. people who were doing a lot of really great brain repair. Um, I'm in the world of hormones. I've done hormones for 25 years, and didn't realize that I wasn't optimizing all these hormones for people to prevent MS, because MS is much more likely to be diagnosed once we're postmenopausal. So started learning more along this line, and I just started digging into all the nutrient deficiencies and all of the toxic chemicals that could happen. And lo and behold, I hit the trifecta. I had all of it. I had Lyme disease. I had 4 different tick-borne infections. I had mold toxicity. I had heavy metals. I had high chemicals. I had traumatic brain injury. I didn't optimize my hormones the right way. And it just kept going on and on and on. And I was like, oh my God, I have like everything that I've ever treated a client for, and I have it all. And in some respects, that was very liberating and empowering for me to say, this is a misdiagnosis. This isn't an accurate diagnosis of MS. These are all the things that happen to our brain when we don't treat these things. And so I dealt with all of them. And at the end, I learned of a practitioner by the name of Dr. Goodenow. He's a triple PhD who had studied Alzheimer's disease for 30 years and started learning things that he was doing with a compound called plasmalogens. And plasmalogens are fat sources that we can't make on our own, unfortunately, from food, and we deplete over time. And he was seeing some amazing results in reversing Alzheimer's, MS, Parkinson's, dementia, ALS with the use of plasmalogens. And his was the last thing that I did after cleaning up everything else. And I started using his supplements. And within 6 months, I had a completely normal brain MRI and no white matter brain disease.
Oh my gosh. And
Yeah.
so was it his supplements alone, or was it because you took care of all the other issues first and then you ended with his that it was the combination?
It
Or you're
was
not
definitely the combination.
combination.
If I
Okay.
wouldn't have taken care of all the infections, his supplements would not have actually removed the scarring of the brain. Because
Okay.
we know even if there's infection that causes white matter disease, we've all been taught that we can't reverse white matter disease. It'll be there. Your symptoms will be gone, but the scarring will be there. And it's actually his research that was showing, no, we can actually remove the scarring. And so when all of my symptoms were gone and all of my test results were negative was when I found his plasmalogens and I started the plasmalogens. Um, and I really think that was a big part of it that helped remove the scarring, but I don't think the scarring would have went away had I not addressed everything else before that.
Wow. Okay. So what are all the things that you addressed then? So people are taking this in. So you addressed Lyme disease. So you went through a Lyme, I assume a chronic Lyme
Yep,
treatment
chronic Lyme treatment protocol.
protocol.
And I do that in my office every day. So I became very aggressive with my treatment, which is
Okay.
what I typically tell my clients that have a neurological symptom of Lyme. We want to be aggressive. We don't want that neurology symptom to set in. So I did 18 months of IV antibiotics.
Wow. Okay.
And I included IV nutrients in there and stem cells and peptides and a whole host of different things. I cleaned up the mold. Unfortunately, I remodeled a cottage that had mold in it many years ago.
Okay.
And I am blessed with bad detox genes, like most of the people from the Mediterranean descent. And so I needed to clean that up. I got that out of my body and started repairing and rebuilding, got rid of all the chemicals in my body. And a lot of this I did all at the same time because I didn't have to separate it all. I was able to do all of it at the same time.
Mhm.
Um, but 18 months later, I had a clear brain MRI, which is unheard of these days. We don't
Oh,
don't
yeah.
repair white matter
Yeah.
disease, right? We only help navigate the symptoms, unfortunately.
Right. And then I assume you optimized your hormones as well.
Yeah, definitely went on much higher levels of hormones than I had been on. I've always been taught and been the person that says the least amount possible that we need to balance the symptoms, which I still think from a menopause standpoint is great. But I think when we're dealing with a neurology issue, I think we do need to optimize those for as high a benefit as we possibly can. And the research is very clear on estrogen deprivation, triggering MS.
Mhm.
It's not the cause, but it definitely can be a trigger. And so I optimized hormones, cleaned up my diet even more than I had before. and started really focusing on healthy fats and lots of healthy fats and proteins, more of like a keto carnivore type diet, to really repair that brain of healthy fats and give my body what it needed to heal.
Wow. And then was there any other thing that you had to do besides Lyme, mold, and hormones? Was there more? And
Yeah,
diet?
diet,
Mhm.
chemicals, I had pesticides
Chemicals.
and herbicides in my body, so I got rid of those. And then I started doing some brain retraining, since the white matter was in my prefrontal cortex, so the part of my brain that does all my thinking. It was
Mhm.
a tad bit scary, right? And so I learned about different modalities outside of the traditional world that we could do to heal that prefrontal cortex. I used a device called a prehag, which actually stimulates the prefrontal cortex and then can also calm it down. And in cases like this, where we have too much white matter disease in the prefrontal cortex, the concern is that the prefrontal cortex of the brain never turns off, which I can attest is my life. My brain never turns off, it's always on. And so I started working on trauma healing in the brain, both from the traumatic brain injury that I had, and then all those traumas that happen as a result of non-traumatic brain injury, right? All of the insults that happen to us, we all live trauma. And so this treatment allowed me to calm my prefrontal cortex. And it's interesting, the device itself is very uh, interesting because it's basically a laptop and you're watching movies that emit emotion. And as you
Okay.
become emotional to these things, your brain actually shuts off. And when it shuts off, it stops the movie from playing. And you have to teach your brain to cool down enough during those emotional times so that the movie can turn back on again. And I remember the first time
Oh,
I did this,
wow.
I was sitting there and within like 5 seconds, the movie shut off and I was watching Bridges to Madison County. So nothing really tragic. It was a love story. And my brain turned the movie off like that. And I'm sitting there going, okay, I have to turn my brain back on. I have to let it cool down, turn it back on. How am I going to do this? I'm just not going to think of anything. 10 minutes later, I still couldn't turn the movie on. 20 minutes later, I still couldn't turn the movie on. And I was like, I remember calling my colleague who created this, and I'm like, is this normal? Like, my brain is not going off, and it's been 20 minutes. He's like, that's a bad brain.
Sorry,
Yeah. And I
but
went, of course it is, right? And so it took me quite a while to get my brain to turn this movie on and off in a more rapid time. And
yeah.
I finally got it down to like 10 minutes. My brain needs at least 10 minutes of cool down before it can turn the movie back on. But it's a very interesting process, and you can
Wow.
stimulate a lot of headaches with this kind of thing. So we definitely go slower with it.
What's it called again?
Called a
The
prehag. It's PRIHEG.
Okay.
And it's used a lot in the world of depression and anxiety and trauma, uh, used less in the world of actually repairing someone's brain who's had a traumatic brain injury, which is kind of sad.
Yeah.
But I think it's just not known as well in that world as it is in the psychiatry world for us.
Right. Right. Wow, that's fascinating. So you tackled everything, and it's great because you have this background in medicine that you said, okay, what are all the pieces of my puzzle here that I have to address to get to the point? And then after you addressed all these things, then you went to the supplements.
Mhm.
And wow, okay.
Yeah, and then started to really rebuild and repair. And I was the perfect guinea pig for myself because I know enough about this. I knew what the literature said. I could trial and error different things and see, okay, what made a difference, what didn't,
Right.
what would be helpful for my clients going through this, and what really isn't worth their time, energy, and money. And so in a result of all of that, we've been able to put together a really amazing protocol where we can help clients that have been diagnosed with MS that are either questioning whether or not this is an actual diagnosis or not, or is this a potential, truly MS, but there are some other triggers that are going on there that could be a culprit to it.
Right. And I want to go through that protocol in just a second, but a question for you for personally, some of the things that you did do to repair, do you
Yeah,
still go through any of that now?
I do.
You do. Okay, so there's still
Yeah.
like a maintenance part of it as well.
Yeah, I still do, I'm still heavy on detox, knowing that I have poor genes. And unfortunately, live in a world that's just contaminated with a lot of stuff. And it's hard to stay totally clean. So I go through a detox protocol still on a regular basis every day.
Okay.
There's a couple of things that I do on an annual basis just to make sure my body is completely clean of bugs and bacteria and parasites and all that kind of stuff. So I do a parasite cleanse twice a year. Occasionally I'll do some nutrient IVs, but I really don't need to anymore. And I really have minimal supplements that I use. I probably use maybe about 8 or 9 supplements on a regular basis, and other ones I just kind of rotate as I feel like I need to.
Yeah. Okay. That's good. That's
Yeah,
nice. It's hard to live on supplements too. I mean,
it is.
there's
Mhm.
the physical, like, oh, I have to take all of these today. So
Yes,
yeah.
very
Yeah.
much so.
Okay. And so now this protocol that you put together based on yourself as a guinea pig,
Mhm.
you're able to help people. Is it mostly in person, or can you coach people through this if they're in other states?
Yeah, absolutely. So we do have a practice where I can help people on a regular basis in
Mhm.
person, but I can also help work with other practitioners and give them guidance and medication recommendations, supplement recommendations, those kinds of things. I can also go in and see some clients across state lines. I can treat clients both in Wisconsin and in Florida. So we have quite a few options there for clients.
That's good. So with the protocol for MS, I assume you have some commonalities in the protocol, but it probably depends on whatever you assess of the person's background as well, I'd imagine.
Correct, correct. So, every person has a different story. They get to this disease by many different ways.
Mhm.
Sometimes it's infection, sometimes it's just toxins, sometimes it's like me, you get the trifecta, you get it all. But we look at each person individually and assess their history. What have they been exposed to? What do we think is the most likely culprit? And then we start diving into some testing.
Okay.
And I'm a big person about testing. I think testing is important so we know exactly what we're dealing with. Otherwise, we're just kind of wasting people's money and their supplies and their energy level, because this is draining at times. And so we don't want to do that. So once we identify what are we actually dealing with, then we can put together an exact plan for that person. And everybody's plan is going to look very different.
Yeah. And for you, how long did it take for your symptoms to reduce, resolve?
It took about 6 months for my symptoms to start really resolving, to the point where I thought, "Oh, this is good, like, I'm done, I can't believe this."
Mm.
And, then I retested and I was like, "Okay, I guess not." Even though I'm feeling better, my
Yeah.
lab tests were still showing that I was dealing with some issues, and
Sure.
so I went back and did more treatment for a while, retested again until all of my labs were clean and negative, and I didn't have any thing present anymore that were going to cause neurological issues for me. But most of my symptoms had resolved pretty quickly, actually.
Yeah. 6 months is pretty quickly,
Yeah.
especially when you're dealing with so many different systems in your body that you're
Mhm.
addressing.
Yeah, for sure.
Did you have, I know sometimes with the Lyme treatment, some people have a herxine reaction where they almost get worse as they're detoxing bacteria. Is that something that you experienced with 18 months of treatment?
I did, and I went up and down quite a bit with Herx reactions, and everybody gets them. So for people that don't understand what we're talking about, we're just talking about a die-off reaction. So we're killing off bacteria faster than we can get it out of your body. And so we need to increase detox so you don't feel worse. And I always tell people we want to kill the bacteria without trying to kill you at the same time, because sometimes that Herx reaction can be pretty significant. And I did experience some of that. I had a lot of fatigue. I definitely had some brain fog. Um, it came and went. There was certainly joint pain and muscle pain, which was quite common. I'd say the biggest thing that was the challenge for me, though, was the fatigue and the memory. One minute I'd look at something and I'd be like, oh, I remember that. And then I'd be like, okay, I can't remember this protocol I've used forever. And I have to go look it up. And I was like, okay, this is a little odd. And it's definitely frustrating, but most of it all came back really beautifully. I have, like every person that's in their late 50s, I have that senior moment too, where you can't remember the name of something, or you can't, remember a location of something, and you're just like, oh, what is that? And but it's very minimal.
Okay. Okay. Well, that's wonderful. So now I know, so MS we could consider a chronic illness. Some
Mm.
people kind of consider on the autoimmune
Yep.
spectrum of conditions.
Mhm.
I know the mitochondria is important too in a lot of
Mhm.
illnesses and disease. Can you talk about mitochondrial health a little bit and kind of tie it
Mhm.
into everything we've been
Yeah.
talking about?
Absolutely. And I would agree with people. True MS is really an autoimmune disease. It's an attack on the brain. So we definitely want to treat it like that and look at all the things that trigger autoimmune disease. But mitochondria plays a huge role in that. And so mitochondria is just a big word for cell structure, right? It's our cells that give us our fuel. We call that ATP. And there are a lot of things that can deplete our mitochondria: poor diet, infection, toxins, things like that. But we also know that there's certain nutrients that need to fuel our mitochondria so that our mitochondria can work really well. And so if we're depleted in protein in our diet, or we're not getting healthy fats, or we're getting too much sugar and too many processed foods, that's going to cause our mitochondria to not function as well as it should. And when it does that, usually the biggest area that we notice it in is fatigue, brain fog, and pain. Those are the biggest areas that we see it in. Fibromyalgia is a really great example of this. Fibromyalgia is really just a mitochondrial dysfunctional disease. And if you repair that mitochondria, those symptoms can go away or at least significantly diminish.
Okay, that's good. I haven't heard that with fibromyalgia, so that's good to know to really address the mitochondria with that.
Mhm.
So if someone is looking to improve their mitochondrial health, we is it really just eat more protein and more fats and cut out all the processed sugars and carbs and processed foods? Is it
That's a big part of it, and that's definitely, like, the major step that I would tell people if you're listening to something and you wanna do something inexpensive and doesn't add a lot of supplements to it, that's the route to go. However, we all know changing diet is really a challenge. It's really hard when we tell you to do that. So I think we also need to fuel our mitochondria, though. And there are very specific nutrients that are necessary for fueling that mitochondria. So things like N-acetylcysteine, we call it NAC for short. That's really great at removing some of the toxins and fueling that mitochondria. There's an amino acid called phosphatidylcholine, and choline is extremely important to the mitochondria and to our cognitive function. So it's a source where you can get phosphocholine from our eggs. Eggs are a great source. Sunflowers are a really good source. Soy is a great source, although I'm not a huge fan of soy. But those are great sources to get them from your foods. But if you can't eat those foods or don't like those foods, then taking it as a supplement is really helpful.
okay?
B vitamins are huge. Like anybody that needs to fuel their mitochondria, B vitamins, first and foremost, if you had to only choose one supplement, it would be B vitamins for sure, that I
Okay.
would say would be helpful with that. Glutathione is another thing that helps to fuel that mitochondria as well.
Okay. So that's great ways to really look at mitochondrial health. And how
Mhm.
long does it typically take to really boost up your mitochondria to give them chance to heal and kind of
Right.
regenerate? Is there a timeline for that?
I would say you're looking at a good 3 months to
Okay.
start building that foundation and feeding the mitochondria before you can say, hey, this isn't working or it doesn't look like it's working. You want to give that a good 3 months. Anytime we add supplements or herbs or things like that, it
Mhm.
tends to be a slower process than if we just put a drug on somebody.
Yeah. And then at the same time, so these are things to kind of build. Are you also coaching someone on, okay, let's look at your lifestyle to see what's depleting the mitochondria as well, and kind of
Absolutely.
adjusting that way as well?
Yeah, absolutely. So looking at that environment and seeing, what's present in the environment that's causing higher levels of stress, not getting enough sleep, poor diet again, toxins, chemicals, all of that kind of thing. We want to look at that environment as a whole and really start seeing what depleted the mitochondria to begin with. Sometimes it's a genetic piece. So we'll actually look at genetics and we'll see if there's a genetic predisposition to the mitochondria being damaged, or do you have genes that could make you more susceptible to getting MS or fibromyalgia or having toxins build up in your body because you don't detox properly, things like that.
Got it. And you've mentioned toxins and chemicals. Are there some big ones that people might not recognize or realize that are really affecting them other than, let's say, Roundup?
Yeah, absolutely. So
Right.
Roundup is the common one that everybody knows of. Lead is a big one, actually.
Okay.
And most people don't realize where they get lead from. And they think it's from lead paint, which most of our homes are not allowed to have anymore, but some homes still do. But lead is in our environment every single day. If you breathe air, you're getting exposed to lead. It's just the way it is. Commonly, a lot of medications have had lead in them.
Okay.
Some can be contaminated. We see a lot of lead paint that comes in from products from China. Even basic common things like minerals. If you're buying minerals from a source that hasn't been tested, those minerals can have a lot of toxic metals in them. So lead and mercury and cadmium, things like that. Mercury is another really big toxin that we don't think of too much. If you have silver fillings in your mouth, you're being exposed to mercury. And the older they are, the more they can off gas and create problems for you.
Okay.
Some of our common herbicides and pesticides that we use besides Roundup, like a tick collar, is a toxic element.
Mhm.
And so
Oh,
those have chemicals in it that we're going to become exposed to from our animals.
okay.
Um, Different cleaning solutions actually that we use in our house all the time. Bleach is a common one. Some of the Glade plugins and some of those things where they make our rooms smell good, those are all just chemical toxins that we're breathing in all day long if we're in a home with it, or if
Yeah.
we're putting them in our bedrooms at night when we sleep, that's a problem. Um, so there are a lot of chemicals that we're exposed to on a daily basis that we don't even think about.
Gotcha. Is there a cleaning solution brand that you prefer that you've just found has been better than others?
I like the Miss Myers brand. I think that's really good.
Okay.
Seventh Generation is another really good one. For those people who want to keep it really simple, vinegar and water, baking soda and water make great cleaning solutions. And if you want your house to smell good, just put a couple of drops of essential oil in the water and you'll have a beautiful smell without
Yeah.
all the toxic chemicals to get that nice smell in there too.
Okay. Yeah. Vinegar and water. That's a nice
Yeah,
home remedy that it kind of still works. So that's
still
great.
works and we forget about it.
Yeah. Yeah. Oh, this is wonderful. So we've kind of talked about MS and autoimmune and how this all relates to mitochondria. What
Mhm.
about other kind of chronic illnesses? Is it still the same theme of infections, toxins,
Mhm.
brain health type
Yeah,
theme, or is there
absolutely.
same?
Yeah.
Okay.
Same type of thing. So, and when we define a chronic illness, what we're saying is anybody who's had a problem, whether it's fatigue or pain or brain fog for 6 months or more is what we consider chronic. And there's a lot of people that I meet every day that have been suffering for 14, 15 years, 10 years, and never thought of it as a chronic illness because unfortunately they've seen 20, 30 or more doctors that have told them this is all in their head and it's
Mhm.
just anxiety, or honey, you're just stressed because you're taking care of the kids and doing everything. They've been pacified and they haven't really been given an appropriate workup to find out what's going on with them. And
Okay.
it's really sad because we just continue to see more problems. You know, with chronic illness comes obesity, comes metabolic resistance, comes depression and anxiety. And all of this can ultimately lead to some of the worst conditions that we see. Alzheimer's, Parkinson's, ALS, you know, cancer, all of those kinds of things, when we could prevent a lot of that if we were on the front end of this
Right.
chronic issue.
Right. And you know, you're in the healthcare world. It's hard to make mass changes. You have
Very
to
hard. Mhm.
do what you're doing right here, get out on podcasts, speak,
Yeah.
just start educating people so the wave of changing healthcare start to move forward. It's hard,
Yeah, absolutely. Mhm.
really hard. Now, I know you have a book on this.
Mhm. I do.
Can you share a little bit about the book? If not MS, then what? Can you
Mhm.
tell us a little bit more about it?
Absolutely. So I wrote this book for a couple of reasons. One was to share my story so people could realize that this can happen to anybody. If it can happen to me, I live in this world every day and I
Yeah.
got sick, it can happen to anybody. But I also wanted the book to be very empowering to people that are going through things like this. I wanted them to have tools in their toolbox that they could try on their own before they come and work with somebody like me. I wanted them to have something where they could talk to their regular doctor about it and say, could this be partially what's going on? Can we explore something different here? Um, and then I wanted to give them a lot of encouragement and hope. Um, you know, this is a really debilitating thing for people, and some people, it could land them in a nursing home because they could be completely paralyzed. And it's scary and it's frightening. And unless you surround yourself with other people who think like you, who've been through this, sometimes you feel like you're on an island all by yourself out there. And so I wanted people to have a place where they could share and learn from each other. And then I added a part of the book that I never thought I would add, because I don't talk about this part of my life very much, but I added the spiritual component to healing and how important it is for us to have faith in something bigger than ourselves. Whatever your higher power is, I shared a little bit about what my higher power is, and my journey of spirituality started when I was 28, and just some of the different alternative spiritual healing practices that are out there, so that people don't always have to go to drugs and herbs and supplements. They can explore other things as well.
Yeah, that's extremely powerful. I'm glad you mentioned that because it's not always talked about when medicine is discussed. So it's
Yeah,
good that your your approach is very well rounded in the sense that you're addressing all aspects of what it means to be human. So
yeah,
thank you.
absolutely. Yeah.
Thank you. I appreciate this. Is there anything that we haven't really touched on that you wanted to cover regarding any of these topics?
No, I would just say this, if you're somebody that's been really suffering from chronic illness and you've been questioning, where's this from, what's going on, or you've been diagnosed with something and it's not sitting right with you that it's the right diagnosis, explore looking at somebody who does integrative medicine, because they can help uncover some puzzle pieces for you that you maybe didn't think about. And do your timeline, you'll start to see patterns and things that have happened in your life that maybe the symptoms started around a period of time. That gives us a lot of information when we're helping you. But don't give up. I mean, there's hope out there. There's always hope. It may not reverse 100%, but if think about this, if you could be 70 to 80% better, how much better your life would be. So don't give up, keep fighting for what you're looking for to have your life be.
Yeah. Oh, I appreciate that. And how is the best that people can reach out to you? Even I know, so some people can work with you
Mhm.
directly in Wisconsin and Florida
Yep.
if they want
Mhm.
to for in-person stuff or even for medicine related stuff, but even
Yep.
for coaching or maybe to have you guide their physician or their naturopath, what's the best way can they learn more or reach out to you?
Absolutely. So our website is serenityhealthcarecenter.com. You can learn more about me there, but you can always contact our office as well. And our office is 262-522-8640. You can also follow me on social. We have a Serenity page on social where we talk about a lot of these things. I also have a personal page, which is just Deb Muth, at all the different socials. But feel free to follow me there. And I hope that this helps somebody.
I know it will. So I really appreciate this. And thanks for being so open about your own journey and sharing what's a lot of times is private information. So thank you again for your time today, for helping my listeners. And I just appreciate it. Thank you.
Thank you for having me. I really appreciate it.
And thank you all for joining us today. I hope you have a great rest of your week. We will see you again next week and take care. Bye now.